Botswana Development Corporation has been tasked with the responsibility of securing funds that will help their government to address issues that they are faced with in terms of public health. So there is some sort of collapse which led to the presidency or the President Duma Boko declaring the state of public health emergency in Botswana. Now we are joined by the Managing Director of Botswana Development Corporation, Oteng Keabetswe. Thank you very much for making time to speak with us, sir. So you are having a situation in Botswana, and you have been tasked with that responsibility of ensuring that there's about 5 billion Pula, which is about just a little over 6 billion rand. How do you plan to secure that?
Thank you very much for having me, Itumeleng. As you've already indicated, my name is Oteng Keabetswe. I'm currently the Managing Director of Botswana Development Corporation. I think we are very privileged as Botswana Development Corporation for the President to have seen it that we are able to handle such a task in trying to mobilize private capital for the benefit of our communities in Botswana. From a fundraising perspective, as the BDC, we are looking onto bringing in institutional investors to assist us in addressing this concern. The structure of this capital raise is done through an on-commanded partnership structure where institutional investors will have interest into this partnership and will then be earning some investment returns based on distributions that are made to them. In terms of distribution, we are targeting firstly the local investment community in Botswana because there's a bit of liquidity that is there in the market outside the government coffers that we believe we can mobilize. Nonetheless, we've also started engaging international investment communities. Here, I'm currently in South Africa, where we are currently meeting with development finance institutions to really position this fundraising activity for this strategy as well as other strategies that BDC is currently embarking on.
So how did Botswana get to this point? I mean, somebody would want to understand that. How did you get to a point where you did not have money, in layman's term, to buy medicines for ordinary people in Botswana?
Thank you very much, Itumeleng. I think, as you know, Botswana is heavily reliant in mineral revenues. Diamonds have not been doing well for quite some time. And the price and obviously the buying activity in that industry has been really slow to non-existent. So this means that Botswana is responsible for, diamond mining is responsible for 80% of exports revenue into Botswana. And it's a big contributor to the government budget. And over time, in the last couple of months, government has not received cash flow from this revenue source. And that means that now the government budget is under pressure and you are not able to then disperse into some of the areas that have been budgeted for. And with reduced liquidity in the healthcare space, as you know, a lot of people will then now start taking advantage. As you know, I think the president yesterday did mention that the current suppliers into this sector were charging us over 10 times what you would normally pick from direct procurement processes. I think he did indicate that over the last couple of days, we reached out to the local supply community to say quote for this 6 months worth of supply. I think the quote came slightly above 700 million.
Thank you very much, sir, for making time to speak with us. So that is Oteng Keabetswe, the Managing Director of Botswana Development Corporation. They have been tasked with that responsibility, as we indicated, of securing funds, about 5 billion Pula, about which translates to about 6 billion rand, to address the situation that they are faced with as the country of Botswana.